Assalamualaikum warahmatullahi wabarakatuh. My name is Dr. Rayhana Kuddah. I'm from Faculty of Medicine and Health at University Muhammadiyah, Jakarta. Field of research in SiRes. Title of research, Characteristic Clinical Symptoms Laboratory and Antibiotic Treatment of Pediatric Patients who were inpatient hospitalization for typhoid period January until March 2017. The background of this research, the regions with high incidence of typhoid fever include South Asia, Central Asia, and Southeast Asia. Typhoid fever is still an important health problem in developing countries, including Indonesia. Based on data from the Ministry of Health, typhoid fever is the 3rd largest disease in hospitalized patients. The signs and symptoms are non-specific, and that is why the typhoid fever often goes unrecognized. The ciprofloxacin is the drug of choice for MDR-TV ETL for treatment worldwide. However, it was reported that Salmonella typhi isolates showed resistance for to fluoroquinolone in some parts. Research objective to describe characteristic clinical symptoms, laboratory and antibiotic treatment of pediatric with typhoid who were hospitalized at the Hospital X for the period January until March 2017. Literature review, the clinical features of typhoid fever vary from mild fever, malaise, and dry cough to severe with discomfort in the stomach, altered mental status, and accompanied by complications. About 10 until 15 of patients will experience complications, especially in those who have been sick for more than 2 weeks. In the case of quinolone-resistant Salmonella typhi strains, 3rd generation cephalosporin are recommended as first-line treatment. Research method. Types and design, we used retrospective descriptive cross-sectional approach and then place at the X hospital and from January until March 2017. We use data processing, MS Excel, and MS Word. Sampling technique, we use total sampling. Population pediatric typhoid hospitalized at the X hospital January until March 2017. Inclusion criteria, we get a sample 127 people medical record. We use secondary data. We use analyze with univariate and we have a result. The result from distribution by age, the highest is 5 until 9 year old, 76%, and the distribution by gender, male 65 patients with 51.18%, And the duration of hospitalization, the highest of the duration at 37 patient with 29.13%. The Widal examination result that we have two types, titer O and titer H. Titer O, the highest is negative at the 44 patient, and the titer H, the highest is 320, and the percentage is 38.26. Tubex examination result, the highest category more than 4 at the 93%. The Leukosit measurement results, the highest is normal at 70%, and the hemoglobin measurement results, the highest is 11.5 until 15.5 at the 49%. And the clinical symptoms, the highest is a fever, almost 100%. And then the nausea, the second is nausea. And then a coach and a gag. The distribution treatment of antibiotics, the highest we use a ceftriaxone at the 85%. The duration 4 days. The treatment results improve, category improve at 99.21%, and none died, and non-patient died, and patient with allergy just one from 127 patients. The result and discussion, the result of this study are in line with research conducted at Sangla General Hospital. Fever as many as 50 people, 100%, followed by nausea. At Santa Elizabeth Hospital, Medan, the highest clinical symptoms were fever, 100%. And the use for antibiotics at Sangla General Hospital, namely ceftriaxone, as many 17 people, 34%, followed by levofloxacin, 22%. At PMI Bogor Hospital, ceftriaxone for 64.54%, and followed antibiotic levofloxacin. At RSUP Dr. Suraji Tirtonegoro, Klaten, ceftriaxone as much as 31.76%, and followed ciprofloxacin. In India, ceftriaxone 14.66%, and then followed with cefixime. Conclusion: The antibiotic that is often used in ex-hospital in January until March 2017 is ceftriaxone. Ceftriaxone is effective in treating typhoid fever with a cure rate 99%, with an average cure of 4 days. The most common symptoms experienced by pediatric typhoid patients was fever. Thank you for listen my presentation. Assalamualaikum warahmatullahi wabarakatuh.